There is a lot of new information on COVID-19 here in Connecticut.
In fact, there are some figures, both positive and negative, that indicate where we're heading tonight. Channel 3 Eyewitness News reporter Matthew Campbell is live. He's at Hartford Hospital with more on what he's learning tonight. Matthew?
Yeah, Mark and Aaron, we did discuss some of those numbers at the top of our broadcast, but to kind of show you where this thing is headed in the weeks to come, I want to start with this clip from the news conference earlier today. Take a listen.
We tend to double the number of people who are infected every 3-4 days. And that gives us an idea of what our capacity is going to be looking like over the next 4 weeks.
So the state is seeing cases double every 3 or 4 days. So we did the math on that, and this is kind of how it breaks down. You can take a look at how it breaks down with it doubling every 4 days. By April 20th, 53,000 people could be infected. And we'll keep that full screen up just to kind of let all of that sink in. We did a little more math. The governor says 15% of those infected are usually hospitalized. So using that number, 53,000, and then giving 15% of that, that's nearly 8,000 people who could be hospitalized before April is even over.
Unfortunately, the virus is working at warp speed as well.
Governor Lamont did the math too and sees the writing on the wall.
But number one, we have to look at in terms of facilities. How can we get more beds? How can we get more space?
Today, he unveiled part of his plan. It includes dedicating 2,000 nursing home beds and converting dorm space into hospital rooms. Lamont also demands hospitals get creative.
I want to see 50% increase in capacity. Show us how you're going to do it, over the next 4 weeks.
One answer has been to postpone elective surgeries. That move alone, the governor says, freed up 30% of rooms at many hospitals. But the protective gear medical workers need to treat the patients and conduct coronavirus tests are still low. The governor has a dedicated team to track down the necessary items.
Going after ventilators, chasing down sources and opportunities around the country.
With confirmed cases rising to 415, that's 88 in one day, we asked what doctors are learning from these numbers.
The number of deaths will probably be much greater than what we see in an average flu season, which is somewhere between 300 and 600.
On a positive note, they say we may be reaping the rewards of social distancing, especially in areas like Hartford County, where there are 61 cases. In Fairfield County, there are 270. Westport alone has 74.
And I'm actually pleasantly surprised that Hartford and New Haven County aren't more impacted yet.
During this period of social distancing, children around the state are doing distance learning. And new tonight, we learned that will continue until at least April 20th.
What can we do for these kids now? I do not want to lose a semester.
Through donations, the state reached a deal to get 60,000 laptops for high school students to continue the online learning at no cost to taxpayers.
Doing everything you can to make sure this is not a lost semester, but an opportunity to reinvent yourselves and reinvent education.
And one more positive, this time on the hospital front. Here in America, we're seeing the patients that need to be hospitalized in the ICU for about 2 weeks. In China, its patients were in the ICU for 4 weeks on average. So if that trend continues, that could ease the burden here on local hospitals. That's the latest. Live here at Hartford Hospital tonight, Matthew Campbell, Channel 3 News.
Okay, we need any good news we can get, Matthew.